JYNARQUE, tolvaptan mechanism of action. JYNARQUE is the first and only FDA-approved treatment indicated to slow kidney function decline in adults at risk of rapidly progressing ADPKD. JYNARQUE, a selective vasopressin V2 receptor antagonist, prevents the binding of vasopressin at the V2 receptor in renal tubular epithelial cells, which results in decreased intracellular cyclic AMP concentrations. By reducing cyclic AMP levels in these cells, JYNARQUE reduces the rate of cell proliferation and fluid secretion into the cystic lumen, which in turn decreases the rate of cyst growth, ultimately reducing the decline in eGFR. Indication and important safety information for JYNARQUE, tolvaptan. Indication. JYNARQUE is indicated to slow kidney function decline in adults at risk of rapidly progressing autosomal dominant polycystic kidney disease, ADPKD. Important safety information. Warning: risk of serious liver injury. JYNARQUE, tolvaptan, can cause serious and potentially fatal liver injury. Acute liver failure requiring liver transplantation has been reported. Measure transaminases ALT, AST, and bilirubin before initiating treatment at 2 weeks and 4 weeks after initiation, then monthly for the first 18 months and every 3 months thereafter. Prompt action in response to laboratory abnormalities, signs, or symptoms indicative of hepatic injury can mitigate, but not eliminate, the risk of serious hepatotoxicity. Because of the risks of serious liver injury, JYNARQUE is available only through a risk evaluation and mitigation strategy program called the JYNARQUE REMS program. Contraindications: history, signs, or symptoms of significant liver impairment or injury. This contraindication does not apply to uncomplicated polycystic liver disease, taking strong CYP3A inhibitors, with uncorrected abnormal blood sodium concentrations, unable to sense or respond to thirst, hypovolemia, hypersensitivity, for example, anaphylaxis, rash, to JYNARQUE or any component of the product, uncorrected urinary outflow obstruction, anuria, serious liver injury. JYNARQUE can cause serious and potentially fatal liver injury. Acute liver failure requiring liver transplantation has been reported in the post-marketing ADPKD experience. Discontinuation in response to laboratory abnormalities or signs or symptoms of liver injury, such as fatigue, anorexia, nausea, right upper abdominal discomfort, vomiting, fever, rash, pruritus, icterus, dark urine, or jaundice, can reduce the risk of severe hepatotoxicity. To reduce the risk of significant or irreversible liver injury, assess ALT, AST, and bilirubin prior to initiating JYNARQUE at 2 weeks and 4 weeks after initiation, then monthly for 18 months and every 3 months thereafter. Hypernatremia, dehydration, and hypovolemia. JYNARQUE therapy increases free water clearance, which can lead to dehydration, hypovolemia, and hypernatremia. Instruct patients to drink water when thirsty and throughout the day and night if awake. Monitor for weight loss, tachycardia, and hypotension because they may signal dehydration. Ensure abnormalities in sodium concentrations are corrected before initiating therapy. If serum sodium increases above normal or the patient becomes hypovolemic or dehydrated and fluid intake cannot be increased, suspend JYNARQUE until serum sodium, hydration status, and volume status parameters are within the normal range. Inhibitors of CYP3A. Concomitant use of JYNARQUE with drugs that are moderate or strong CYP3A inhibitors, for example, ketoconazole, itraconazole, lopinavir, ritonavir, indinavir, ritonavir, and conivaptan, increases tolvaptan exposure. Use with strong CYP3A inhibitors is contraindicated. Dose reduction of JYNARQUE is recommended for patients taking moderate CYP3A inhibitors. Patients should avoid grapefruit juice beverages while taking JYNARQUE. Adverse reactions. Most common observed adverse reactions with JYNARQUE, incidence greater than 10% and at least twice that for placebo, were thirst, polyuria, nocturia, polyuria, and polydipsia. Other drug interactions. Strong CYP3A inducers. Co-administration with strong CYP3A inducers reduces exposure to JYNARQUE. Avoid concomitant use of JYNARQUE with strong CYP3A inducers. V2 receptor agonist. Tolvaptan interferes with the V2 agonist activity of desmopressin, DDAVP. Avoid concomitant use of JYNARQUE with a V2 agonist. Pregnancy and lactation. Based on animal data, JYNARQUE may cause fetal harm. In general, JYNARQUE should be discontinued during pregnancy. Advise women not to breastfeed during treatment with JYNARQUE. To report suspected adverse reactions, contact Otsuka America Pharmaceutical Inc. at 1-800-438-9927 or FDA at 1-800-FDA-1088, www.fda.gov/medwatch. Please see full prescribing information, including boxed warning, available on this website.